Like just yesterday, I was running, chasing my own tail, so busy, and one of our residents at the Alama came by, just staring me in the eyes, and she's not vocal. And that made me pause, that made me stop right there, reassess my priorities, and just greet her kindly and gently and slowly. And there was such joy in that little moment that, thank you, I'm gonna call her Kate. Thank you, Kate, for giving me that moment where I could pause myself, reassess my priorities and say, thank you for being alive, for being there for one another. Every day I go through an inspiring situation with our residents, and I try to pass it on to the family members who serve as well. I like to know who I am speaking to, so I'm going to just ask a couple of questions. By a show of hands, who is here because you're worried about somebody in your life, either a neighbor, a loved one, a friend? Okay, thank you. And who is here because you're worried about yourself? And who doesn't know what the heck you're doing here? Yeah, that's great. That's a great crowd. This is one very difficult subject, and I'm so happy for you to be here because you face this reality of cognitive loss as we age. So we are going to speak, there are many other ways of losing cognition through our lives, but we're going to be talking today about one particular way, dementia and a progressive dementia. And I'm a specialist in memory care, and that's the very reason why I do not get an invitation for dinner parties. So I'm happy you guys are here, so I can change my frame of mind here. So let's just review a little bit of what dementia is, because there's so much misunderstanding about what dementia is. Dementia in general is a loss of cognitive skills. And it can be in all those areas. We normally attach dementia to memory loss. Memory loss is just a part of it. We're talking memory, but we're also talking attention, judgment, language. So many people, their very first symptoms are not memory loss, are language loss, retrieval. Organizational skills, that's really important for us as we age and get on Medicare. You gotta get your shit together, right? It's so difficult to just manage healthcare issues in this country. So, and that's the time that we need those skills the most, and sometimes they start declining. Abstraction is one that's hard for people to manage. It's just time. Think time management. Time doesn't really exist. It's a convention, right? And you have to think abstractively to understand time. So those skills start to decline as well. Reasoning, that's one that drives the caregivers the most crazy. Reasoning skills, like, you can't do this because of blah, 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 and they just don't get it. Every time you try to reason with a person with dementia, you fail. And perception, another difficult concept for us to understand, because we all have it, we don't even notice that we have it. But most people with dementia, they fall. They are high fall risk, not because of the muscles or the pain or the joints, but because of perception. They walk around without situation awareness. So every single one aspect of cognition, they interfere with the other. talk about perception here. They interfere with the other, and one aggravates the other. And once those difficulties, those impairments start interfering with your ability to live your life, to do the things you want to do on a daily basis. So that's when the memory impairment is declared dementia. So from memory impairment to dementia, the only difference is there has been such a high level of impairment that now you need help. You cannot do it. You're trying to come here in the morning, and instead of getting here, you get somewhere else. You get lost in the traffic. You go to the supermarket, forgot what you're doing there, and come here and forget what you're here for. So that would be the main difference between dementia and just cognitive impairment. Then what causes dementia? And I'm just going to focus on progressive dementia because there are other kinds of dementias like brain injury, dementias related to infection, sepsis, other issues. But the dementias that are caused by some progressive diseases, most people will be diagnosed, if they do have progressive dementia, with Alzheimer's disease. And Alzheimer's is about 70% of all of the dementia, as far as we know of today, because we're still learning so much about these conditions that things may change. It might be that later on we will discover something that will tell us, hey, that guy looked like he had Alzheimer's, but he actually does have Lewy bodies, or yet something new that we don't even know. But so far, most people are diagnosed with Alzheimer's disease, and President Reagan is, probably the most famous person who had Alzheimer's disease. Lewy bodies disease is another one that it has gained notoriety lately because we are learning more about it. It's normally related with Parkinson's disease. So if you have Parkinson's disease, you may not have dementia, but if you have Parkinson's disease and dementia, you probably also have Lewy bodies disease. They come together. They come standalone or together. Frontotemporal dementia, Bruce Willis has it, and it started with aphasia, inability to communicate with words. So you see how serious this can be. Vascular dementia is the one that is most common actually, because many people with Alzheimer's do also have vascular dementia. And people with Lewy bodies can also have vascular dementia. With frontotemporal, they can also have vascular and Parkinson's disease. And I'm going to explain a little bit about that later. Just in the picture, Robin Williams, he was first diagnosed with Parkinson's disease, and later on they found out that he also had Lewy bodies disease. So it was a very sad case. And here's what happens, and specifically about Alzheimer's. So in Alzheimer's disease, my little finger doesn't work here, but there's the side-by-side picture. The healthy brain is like lots of tissue, no spaces in between areas. And then when you start having Alzheimer's, the spaces in the brain start growing. Why are the spaces growing? Because the brain itself is shrinking. So in an MRI picture, that's what the doctors will be looking. So the bigger the spaces in the brain, the more advanced the case of Alzheimer's disease. So a brain with advanced look like that, full of holes. And those holes are related to the brain cells that aren't there anymore. They actually disappear. they are not, they're dead. They're not, they really do disappear. Yeah. Yes. The thing is, like, if you get in an accident and you scrape your skin, you can expect with time a new skin will form and it will regenerate itself. With the brain, that doesn't happen. Once a brain cell dies, it gets washed away from your brain. It doesn't come back. That's the biggest challenge, because sometimes the family members, say, "Oh, my mom is losing her cognition, and we want to train her to regain the memories, to regain the skills." You don't have the hardware to regain the skills. So we have to treat every patient with whatever hardware is still there. So the goal in treating people with Alzheimer's, and I'm focusing on Alzheimer's, but that goes for every progressive dementia, is not recovering skills. Because if the skills were lost, they were lost for a reason, not because you've forgotten, but your brain has shrunk and is no longer able to grasp a complex subject. So now the goal is, let's focus on the skills that are still there. And let's practice, let's encourage, and all the therapies for the care of a person with Alzheimer's, they do focus on that. Not regaining skills, but keeping the skills that they still have. Because that's where the brain is. Questions so far? Ooh, now you know my problem with the dinner parties. Okay. Yeah, this is very scary and this is very serious. So, in Alzheimer's in particular, and this is going to be relevant further down the line here, the brain cells, they die because we think because of two reasons. So there are two proteins. One is tau, and tau lives inside the brain cells. And the other is amyloid. So those two proteins, they start breaking apart and getting like tangled to one another. So one breaks down tau inside the cell and kills the cell from the inside out. It clogs the cells functioning. The other, amyloid, and you see that little mass, it's a representation, but it gives you the idea. It breaks outside of the cells and creates these little clumps, these sticky things that mess with the functioning of the cells and kills the cells from the outside in. So there are two processes happening, and we know that those processes are happening. We don't know why, what triggers it, we don't know how to stop it, and we just recently found some medication that is able to slow down the appearance of the amyloid plaques. So, and we are working really hard on another medication to slow down the problem with the tau protein. So if we get to those two things together, we already know more or less how to stop tau temporarily from accumulating, breaking down and accumulating. And if we can do that with tau, that's a very good chance that we are going to be able to slow down really significantly the progression of the disease. But at the same time, we have found out that that is not the actual cause of the disease. something is causing amyloid to break. Something's causing tau to break, and we still don't know what it is. So we are getting close. There is a lot of good research going on, and most of the research is now trying to figure out these processes. And there are other research that is geared to address the other issues. And the biggest other issue that is also involved with all sorts, not only Alzheimer's, but all sorts of cognitive decline is the vascular issue. You know, through our lives, we make decisions, and we expose ourselves to intense heat, or sometimes how many times, you know, I've been around and forgot to bring water, and, you know, so I dehydrated myself, or went without food because I thought I could drive all the way to San Felipe in Mexico and not have a snack in the way. Yeah. So we make decisions, and sometimes we expose our brains to stresses. And many of the stresses, they do result in our brains starving of either food or hydration, or oxygen too. So, you know, people who smoke, they are actually depriving their brains of oxygen. And little by little, brain cells will be dying. We have 100 billion neurons in our brains. So one or two, if you kill them, it's not gonna make a significant change. But if you end up killing, you know, at 20%, you start noticing memory loss, and goes from there. So one of the biggest issues that happen for exacerbating, for making the disease progress quicker, is an ongoing vascular disease. And vascular disease could be related to high cholesterol. High cholesterol collects inside your vessels and form plaques. She was teaching me how to pronounce that, plaque. Normally I pronounce it plaque. I don't know why, but plaque is the right thing. And then it causes aneurysms, that is the actual obstruction, and you can have a stroke. Or you can also have heart disease because of the same issue. So everybody who does have heart condition also is at a high risk for memory impairment. And this is why people don't even realize that. But on 0 to 4 minutes of oxygen deprivation is probably not gonna hurt you. 4 to 6, there is brain damage. Brain damage means some brain cells have died. It could be huge, could be small, but at 6 to 10 minutes, brain damage is really likely. And if anybody is deprived of oxygen for 10 minutes, there will be death. You will not survive that. But this, you know, if you look at the brain as a whole, it's true. But every day we are exposing our brains to stresses, and this could be happening also at the cellular levels. Over the years, there is a cumulative damage, and that's why most people, they do have vascular dementia once they hit, you know, their mid-90s. It's just a cumulative effect of the vascular stresses that we have put on ourselves. Sometimes it's genetic, and that's why we go to the doctor, and we're gonna have, you know, our high blood pressure under control, our high cholesterol under control. If you don't know your numbers, please find out, because this is extremely important for preventing cognitive decline as we age, for slowing the speed with which we have even if you do have Alzheimer's, if your vessels are intact, you're going to have a beautiful life with Alzheimer's, and it's going to be a long time. So that's really the difference. You want a question, right? No? Okay, just a moment. I'll get you. So this is the real difference, because have you ever heard that somebody had Alzheimer's but lived about 20 years, right? And others have Alzheimer's and lived 5? This is the difference. This is the difference. So in my experience, like boots to the ground experience, knowing people with Alzheimer's on a daily basis, the ones who do well and live a really nice, experience for many years with Alzheimer's, they have what I call the pure Alzheimer's. Otherwise, they are healthy. They don't have heart disease, they don't have vascular disease, because this has not occurred any time in their lifetime. And those are about only 15% of the population I have had the privilege of serving. And most of others, they do have vascular disease. And people always ask me, how much time does my loved one have? I don't know. This is going to make a huge difference. The more intact you are in your vascular system, the better you're gonna do, the better you're gonna benefit from the strategies and from the medicines available.
How do you explain breath-hold diving or free divers that can stay underwater for 10 minutes but not have this?
They have to go through a process of hyperoxygenating before they do that. So they are hyperoxygenating, so they create a little reserve before doing that. So this is something that we do not do, like, So they are preparing for the deprivation ahead of time. But I have not seen any studies with cognition for those deep sea divers. That would be a fascinating thing. And I would suspect that at some point their cognition will decline, because it's very difficult to deprive your brain of oxygen and do not have any symptom from it. Got it? All right, let's move on. So risk factors. We all have some of these risk factors. So age, of course, is the biggest one for Alzheimer's. The biggest age group for having Alzheimer's is mid-80s. So most of the people who are diagnosed with Alzheimer's, they have been diagnosed in about like 82 to 85, not 90. 90 would be more vascular. Sedentary life, because if you don't move, the blood in your body doesn't move, and that's again related to vascular. Everything comes back to vascular. So if you move, if you exercise, you are stimulating your circulation. You're getting fresh blood to your brain, and that's why sedentary life is a high risk group. Obesity, for again, vascular, because obesity tends to accumulate fat cells or fat particles in your vessels and create obstruction. If you have heart disease, you are a higher risk. If you have diabetes, you are a higher risk, 30% higher risk if you have diabetes. High cholesterol, huge. High blood pressure, huge. And also family history. What you don't see on the risk factors here is smoking. And that's because most people who do smoke, I'm talking cigarettes, they don't live to be in their mid-80s, so they are not high. But if they do, they will probably have some form of cognitive impairment. Yes?
recreational drug use as a youth?
I would say for the same
Luciana,
reason.
can you repeat the question?
Yes, please. He is asking me about why is not recreational drug use here. And probably because of the same reason, if you abuse drugs in any way, shape, or form, your lifespan is going to be shortened. You're not going to be live to be in your 80s, and in your 80s is when most cases appear.
About asthma, would that have any exposure?
About what?
Asthma?
Oh, yes, asthma, anything that deprives your brain of oxygen. Good question. Yeah, pollution. Just think about it. You have to oxygenate and you have to feed your brain.
How about cell phone use?
Repeat the question, please.
I think she's asking about cell phone use. In the handout that I put for you, cell phone use is when we have studies about cell phone use, not exactly in about cell phone use in relationship with dementia, but cell phone use in relationship with insomnia. And people who do have insomnia, because your brain needs to rest, are also at higher risk. So stopping, closing the computer and the cell phone like 2 hours before going to bed is a really good thing for sleep hygiene, and everybody would benefit from that. Yes?
Can you please expand a little bit on family history? Because everything above that a person can deal with, but what is the effect of genetics and family history?
What a great observation, and that's exactly it. Most of the factors that put you at higher risk for cognitive impairment are manageable. Our own lifestyle are things that we can change. We cannot change family history yet, but we will. And I'll explain you why right now, because family history means what the doctor will ask you when you come for a consultation. How long did your mother live? How long did your grandparents live? What did they die of at what age? And so there are groups of genes that go into the family history, and that's what they're looking for. Genes that will put you at higher risk for this kind of disease. So if everybody in your family has had a heart attack by the age of 50, you probably have a higher tendency to have problems, and you need to monitor these factors here really close. But now, and I said yet, because now there are really studying and changing CRISPR technology. Have you ever heard of it? It's gene editing. I am so excited about it because just this week there was a great publication saying that gene CRISPR editing has managed to cut the gene that put people at higher risk for cholesterol imbalance. And it only takes one infusion and changes it for life. Of course, there will be a lot of study necessary before we all hop into it and infuse me, right? But it's a wonderful new avenue to hopefully in the future control the only factor that we cannot control yet, family history.
But sometimes I'm the youngest of 7, and a lot of my siblings have had stuff. But their stuff could have been, they've been involved in drugs and stuff, and cigarette smoking. So that,
What she's telling me is that among all the siblings, everybody did have some cognition issue, but at the same time, they did get involved, and that's exactly involved with drugs. But that's exactly my point. Every decision, good or bad, influences your brain. Even being here right now and sitting in a chair, feeling uncomfortable, shuffling around, talking to, reading my brochure. Everything is actually making changes in your brain. And we have those choices every day. We can choose positive changes and we can choose negative changes. Always going to make a difference in the future. 30 years from now, if you were good to your brain, if you treated your brain correctly, your brain is going to be more resilient. So in your family, you had people who worked against resiliency.
So that would be genetic from that person.
No. So some issues we can control, some issues we can't. All right? Okay, so when diagnosing Alzheimer's or any other form of dementia, a person will have some cognitive symptoms and will go to the doctor. So they will take the medical history. Neuropsychological evaluation is just sitting with a therapist and answering questions. Sometimes it takes 2 days of questioning and answering for a complete neuropsychological evaluation. A physical examination, is there something else going on in your body? Lab tests, they will test for vitamin deficiency, hormonal imbalances. They will do a complete balance. They will want to look at your brain too. They will want to look if we have spaces in the brain. There is normal aging, and at some point, the doctors will see on the MRI a little spacing, but those are related to normal aging. A lot of spaces, it would be Alzheimer's and other conditions. And then for Alzheimer's in particular, this is new. Percivity is a blood test that will check for the amyloid. Remember the amyloid from the other slide, that sticky, gooey thing? So if you have high amyloid, then you probably do have Alzheimer's, and that's the test. It's a blood test. It was approved in 2021, and now anybody can have it anywhere. If you go to the doctor and the doctor, it looks like Alzheimer's, but I'm not sure, you can take that test. It's a blood test.
Does Medicare pay for it?
Good question. It does pay because it has approved, but you have to have a good symptoms and reason for it. I myself, I'm not cognitively impaired, so if and we know that sometimes those plaques start in your brain like 20 years before symptoms. And if I am worried and I want to go to the doctor and say, please give me the test, Medicare is not going to pay that. But if I am failing, if I'm struggling, if I forgot how to make my coffee in the morning, if I show up to the doctor wearing 2 shoes of different kinds, then there is justification for it.
How good is it to wait that much longer to have that test done when you've now it's already created a bigger issue inside of your brain, and there may or may not be the right way to go to continue treating it?
Well, go ahead.
Repeat the question.
All right, so, so sorry. The question is, what good does it do to learn, this information sooner rather than later, once you start having cognitive problems? I would say that before the advent of the medication for Alzheimer's in particular, it wouldn't make any difference. But now, as to where is it? Okay, now this slide here tells me that there are some medications. Remember I told you for the sticky amyloid? So these medications have been approved, one in 24 and one in 23, for dissolving those plaques and clearing the brain. It's a medication that can only be taken for those who have indeed a diagnosis of Alzheimer's, proven by the percivity test. So we have to find those amyloids, because the treatment is to clear amyloids. If you don't have amyloids, you don't need a treatment, right? And also, this other test here, that tests your spinal fluid, because there is a gene that there is a gene related to the Alzheimer's, that if you have that gene and if you take this medication, you will also have area. Nobody wants to have area. It is like your brain explodes. Yeah, not good, not good. So nobody wants to have area, so they test the gene, for the APOE4. If you have that gene, you cannot take the medication, even if you have the amyloid. So again, this is only the beginning. So the people who I know who are taking this medication, they feel better. They feel that the decline has eased. They don't go back to before having symptoms, but they feel that the symptoms are slowing down, and that slowing down for the people that I'm actually talking to, real people, it has lasted a year or more. So it's a good thing to consider it, but when do you do it? Everybody has one of these, right? So time to open this, because this is what gives us the idea of where a person is in a disease. So the care, when you talk about Alzheimer's care, we are not talking about so much the chemistry of it. We are mostly talking about the symptoms. What is the stage of the disease? So between stage 1, no symptoms, and 4, a few symptoms, moderate cognitive decline. By stage 4, you can tell, if a person has Alzheimer's or not, and that's the time that you want to start taking those medications. So in answer to your question, that's a complete answer. Look at the stages. And anybody can look at the stages and find out, your loved one, what stage are they at this very moment? Most people at stage 5 could use a personal caregiver, somebody right there by themselves, because that's when you start getting really confused, lost, you forget to eat. There are so many different safety issues that start happening at stage 5. And at stage 6, that's where everybody goes berserk. Because at beginning stage 6, there's hallucinations, there are delusions, there's deep anxiety, crying issues, and it fluctuates. So you wake up great, and at the end of the day, you have that thing called sundowning, and you just lose it. You don't know what to do with yourself. So at stage 5, most people will need the medications that will help with stabilizing a person emotionally, anti-anxiety medication, sometimes anti-psychotic medications, and those, that's for amyloid, and those for cognitive. Those medications for anxiety are mostly off-label. We can use about 30 of them because we know that they're good, they're effective. We've been using them for over 30 years to help a person calm down and just cope with the confusion, with the aggravation. There are only 2 medications approved by FDA, and they were approved, one Rexulti in 2015, and the other, the Belzombra. That one is mostly for insomnia, because a lot of people who have Alzheimer's can't sleep at night. But the other 30 medications or so, they are not actually approved for dementia patients. So what happens when a person starts getting on stage 6 and becomes really confused, disoriented, agitated, nervous, sometimes the doctor will recommend one of those, And then the family member will go on Dr. Google. Not approved for Alzheimer's and dementia. Oh, then, everything breaks loose. We need to use every weapon we have to help people, stay even keel as much as possible. Yes?
Well, according to this, if you have no impairment, you're at stage 1 of Alzheimer's. So does that mean everybody has Alzheimer's?
No impairment, stage 1. I love that question. So let's go back here.
Stage 0.
Okay, so no impairment. We know that now we know, most of the stuff that we know about Alzheimer's has been learned only in the last 20 years, even though Alzheimer's was just described in 1905, right? So most of it is, last 20 years. So this process here with the amyloid and tau, now we know that it can start happening and destroying your brain cells up to 20 years before any symptoms arrive. So you say, level 1, no impairment, but no cognitive impairment, but the process has already started in the brain.
So people who will develop Alzheimer's may have no impairment for a period of time.
That means me. I could be already having this process starting in my brain, and 20 years from now, when I start my 80s, that's when I'll see the impairment showing. Goes back to your question, when should we start treating? We're still learning. But I would love to start treating this before I get to my 80s. Maybe if I have already started with this process in my brain, by the time I am in my 70s, I want this out of my brain. I want the gooey stuff out.
With the protein amyloid and tau that you mentioned on that slide earlier, you mentioned that there were some developing treatments, perhaps some pharmaceuticals that are being developed. How far along is that?
How far along are the new developments going? We really don't know that. I'm hoping, I'm always positive, I'm hoping that something will come up soon, but there are so many complications. For example, the first drug here, Leqembi, was first, they kind of approved before 2023, and then health workers are like, no, this is not a good drug, people are dying, the brains were exploding, so they reviewed the medication, changed the dosage, and did it again, so even though there are some strategies, firm strategies being developed, we don't know how far we are. And even after approval, it can be some back problems, and they have to review it. So it's complicated. Why is it so complicated? Because, to test these drugs to make sure they work, they have to study people. And it takes a decade to find out if you're benefiting from the drug or if it's your brain, being well supported, and to compare it with your friends. It's a very difficult disease to study. Got it? Yeah? All right. So the bad thing of these drugs that some people are taking because they have amyloid and they don't have the bad gene, they are intravenously. So you have to go to a center and get an infusion. One of them is once a month, and the other one is twice a month. But it's only for 6 months, and then you're free to go. So far, that's how advanced we are in treating Alzheimer's. The others, there's no treatment. Yeah, there is no treatment for vascular dementia. The treatment for vascular dementia is watch your cholesterol, exercise, do the things that are good for your brain. Yeah. There are very few treatments for Parkinson's, as we know, and none of them are curative. We don't know how to cure these diseases. So the best we can do, really, is to take good care of our brains. All right. So once you get the disease, you have to take care of it. Now, Alzheimer's or any of the progressive dementias are a disease of the brain, but also they are a financial issue because it's expensive to take care of somebody who are confused, who may be, sometimes belligerent. They don't want to be touched, they don't want to be cared for. A big issue for patients, they don't want to shower. They don't like people touching them.
I have a question. So my grandfather lived to be 93. He's lived alone. He fell and broke his hip and died 6 weeks later because they stuck him in a facility. But he drank a glass of wine every night. And is there other studies on that, drinking a glass of wine?
There is conflicting, the question is, her grandfather lived to be 93 and he drank a glass of wine every day.
He lived alone.
And lived a long time. There's conflicting. There are studies that say no amount of alcohol is good, and others that say especially red wine might be associated with longevity. Some of the people who live longer in the world are living in the Mediterranean, so the Mediterranean diet is supposed to be good for your brain, and they do drink. They do drink the wine, and there's also these anomalies, these super centennials who have drunk all their lives moderately, like Jean Calment. Jean Calment, the woman who we know that have lived the longest, she lived to be 122. Jean Calment. She lived to be 122 and she drank a little bit of wine every single day. She also ate a kilo of chocolate every day. So it's kind of an anomaly, right? So it's I'm all for chocolate. There you go. So for care, levels of care, once a person starts developing symptoms, back to the symptomology as well. At stage 4, the families, the friends, the community can start helping out with guidance, with some support, with rights. And there's a cost for that too. There's a personal cost. There's the cost of the involvement of our families. Then as it progresses, like at stage 4 or 5, it's appropriate to go and start using a day center. In Santa Barbara, we have the Friendship Center. I don't know if you're familiar with it. It's a great place where people can go. They have brain exercises. They have social stimulation. It's a lovely place for a person in that situation to help keep their skills intact. Then, as things progress, and then how to pay for it? Everything mostly self-paid, but if you, and today is Veterans Day, the VA pays for a lot of this care for qualifying veterans. Not every veteran qualifies, but it's always good to explore that option. In-home care means that somebody's going to come to your home and help you, maybe with hygiene, maybe with cooking and medication. Imagine how confusing it is to take medication, and as we age, we all know this. We take more and more pills. They have different shapes and colors, and some with food, some without food, and it goes on and on. So you can have somebody to help you in the home. That's in-home care. In Santa Barbara, if you hire somebody to help you at home, you're going to be paying between $35 and $40 an hour with an agency. You might get away with a little less from an individual, but it's always a good thing to have a bonded, insured, and backed up agency. Besides, if your caregiver is sick, they have somebody else, so you're always covered. How are we doing time, Carrie?
10 more minutes.
10 more minutes? Okay, I'm finished. Okay, so home health is if you need skilled help at home. So for the gentleman who fell, broke his hip, he probably went, that's the course of action. You go to the hospital, they fix you, they go to a nursing home or skilled nursing, they do therapy, and then you go home and you still need therapy, you still need skilled help. So home health is paid by Medicare, which is great. As long as you need it, the therapist can come to your own house and Medicare will pay for it. And then it starts getting more complicated because you might need assisted living with memory care. So you see all those little dollar signs there? Yeah, it's expensive. So most family will start considering assisted living once the in-home care starts growing and growing, and you need more and more hours. And those hours are so much that it becomes more expensive than memory care, moving somebody to a memory care. In Santa Barbara memory care community, there are many, they're lovely. I am the administrator of one of them via Alzheimer, but there are also the small 6 beds. They are just fantastic. The care is lovely. Expect to pay around $10,000 a month. That's how much it costs. Now, if you, some families prefer to hire caregivers at home, and if you get to 24/7 at home, you will be paying about $20,000 a month in home health, so, home care. So, it's also a financial decision. Good thing for those who have long-term care insurance. If you have dementia, you can't get it, but if you are in your 60s and 70s, you can still get it, and it pays for all that. Then skilled nursing, only if you need that service, you can be attended in your own house, and it's one of the most expensive care that can be. And then there's hospice care for end-of-life patients, and that's also paid by Medicare. So you see, it is a health issue, is a social issue. I would say that the most important decision that anybody, as we age, cognitively or not, that anybody should make first and foremost is, who will speak for me when I can no longer speak for myself? So that proxy, that person who is going to make decisions when you're in the hospital or when you're in the ambulance on your way to the hospital and you cannot speak for yourself, you need to have that person already decided and ready to go. The hospital needs to be informed of who that is, because accidents can happen to everybody. But if you have a progressive dementia, we don't know how to stop it. It's going to come to a point that you cannot speak for yourself. I have a question.
Would you talk about palliative care when that's introduced and why it's introduced before hospice?
Okay. There is a lot of, palliative care versus hospice. Palliative care is a kind of care that is an enhanced care that is provided to those who have a life ending prospective condition, such as cancer or some, this is a life-threatening disease or condition that you have, and you're going to be fighting this disease all to the end. So that's when you go into palliative care. Hospice care is a little more advanced because you have a condition that will probably end your life, and you're like, I want comfort care. Both are considered comfort care. You want a person to be comfortable no matter what, But the difference is palliative care, you're still fighting the disease, and hospice care, even though it's also palliative, you're no longer fighting the disease. And hospice care is paid by Medicare, and palliative is not.
So, Luciana, would dementia be a reason to go to palliative care?
Another great question. Yes, dementia could be if you are back to the stages at stage 7. At stage 7, you're not eating well anymore. You're not able to swallow correctly your food. You're not expressing yourself. So at stage 7, we start considering hospice, and if it's a good fit, we encourage people to get on hospice. But people can get on hospice with dementia on stage 7 and live another 5-6 years. So hospice gets recertified and recertified every 6 months. And some people have been on hospice for 3 years and get bumped out. They're too good. I have a lady at the Alzheimer. She was literally dying 2 years ago. Family from all over the world came to pay her respects. And one day she got out of it, decided it wasn't her time. And to this day, I look at her and like, oh my God, I love you so much. I love you too, dear. And it makes, it warms your heart.
If in your 80s you're occasionally forgetting words, should you consider yourself in stage 2, or is it just a part of normal aging?
That could be part of normal aging. Don't be too worried if you're in your 80s and you're forgetting something. We all forget things. When is normal aging and when it's not? Rule of thumb, if it's normal aging, you're normally able to retrace your steps. Look back and see, I don't know where my car keys are. Then you go back in your brain like, oh, I parked the car, I have shopping bags in my hands, I laid the shopping bags here. Okay, let's go back to the restroom. There are my keys. So you can retrace. If you do have, a memory issue unrelated to normal aging, you're not able to retrace your steps. And all of a sudden, you open your refrigerator, there are my car keys. Yeah.
Backing up a little, you mentioned the importance of having an advanced medical directive. People may like to know that the organization called Compassion and Choices, which you can access online, has advanced directives for dementia that are very useful.
So the name of the association is Compassionate?
No, Compassion and Choices.
Compassion and Choices. .org.
And there are forms that you can just download and print out and fill out as an advanced directive for dementia.
So is an advanced directive?
What you should do when you don't have dementia.
I was going to come to that point. Advanced directives,
And you
power
can attach
of
it
attorney.
You can attach it to My Care that you submit to
Lovely.
Cottage Hospital.
Mhm. That's coming back to that thing that I was saying, the most important decision is who is going to speak for you, because if you do have dementia, you're no longer able to make those choices. So you have to do a healthcare directive. Some people do their trust and attach a healthcare director to that trust. That is fine. However you do it, just do it before you have dementia, because otherwise it's not going to get done. Eileen?
I just want to say, if anybody doesn't know how to do it or doesn't know how to get My Cares, that's something that I can offer you for free. To fill it out, get the forms, get them set in. That's part of what I do in the community. And I know about the dementia ones. The problem is they're not necessarily legal, but it's a good idea to have the dementia part, because it gets fuzzy with it. So if you need that, see me, because I can help you.
Okay, thank you, Eileen. And what's the website?
dyingingrace.com.
dyingingrace.com.
Also Hospice of Santa Barbara.
Hospice of Santa Barbara, and also you can go to the hospital, Cottage Hospital, they have forms there too. So there's no excuse not to doing it, and I have mine. I have mine. I'm prepared. Are you? Yay! Good. So I just I'm going to skip this and go to here. Local resources. So whatever resources you choose, please keep local, because people in Chicago have no idea what we're doing here, and I'm serious. Sometimes you call an 800 number, you have no idea if they even are in the country to answer. So Alzheimer's Association has this 800 number, and also have a local, and they do a lot of support groups here in the community. Center for Successful Aging, and they are a really great supportive organization. The Coast Caregiver Resource Center, they give money to people to put their loved ones in respite care. They help support that. Easy Lift Transportation, yes, putting people around. I already talked about the Friendship Center, great support. Hospice in Santa Barbara was just brought up. Grief support to people. Meals on Wheels, how many people do we know that are getting by on Meals on Wheels alone? A great organization. And VNA Health, it's been on forever, and they do have in-home health and grief support and hospice care. If you are looking for placement, I have a agency, and I would just like to tell you, keep it local. The nationwide, again, they don't know. It's I just needed a new car and I made a mistake, and this is the mistake I'm trying to keep people from making. I called cars.com. And I gave them my information. And for the next 10 days, I received hundreds of calls from people all over California trying to sell me a car. It was a disaster. And the same thing will happen if you call one of those databases like Place for Mom. You will have callers day and night. It's horrible. So stay local, stay with us, we'll take care of you. There are two main agencies in Santa Barbara. One is mine, Home Choices, it's all over the place. And the other is Senior Living Consultant. So either myself or Peggy will take you by the hand and take you there and help you find the best care in Santa Barbara. And we know who they are, because sometimes good care homes fail and become bad care homes. They don't do placement, they do support to the individual. Final takeaways: research your options in advance, local people, solid financial planning and legal planning, know your care needs, work in collaboration with your doctor to keep those numbers under control, and they make a move before an emergency or crisis, because they can be fatal at any time. Thank you.
Questions? Yes. So the question is there an organization that will sub in for like caregivers if they need to go to the grocery store?
Pretty much no.
No. That's when maybe a neighbor could step in for an hour, or family can step in here and there. So,
It's a group partners in caring.
Yeah.
partners in caring, okay?
I do that.
Awesome.
Yeah.
The volunteer will come out.
Partners in caring.
Great. Okay, hang on, one person at a time. Thank you. Partners in Caring, they have a website?
Yes.
Okay, perfect.
Will not Food from the Heart also help with meals?
Food from the Heart will help with meals, anybody know?
Yeah,
Yes.
and organic soup kitchen
Yeah.
too.
Organic soup kitchen, great. What I'm gonna do, hopefully, can I borrow the slide and send it out with all of it? So I'll send out all the information that she has. Susan?
Food from the heart is income based.
Food from the Heart is,
Available to everyone.
okay,
No,
income
but you
limited,
can
on Food
apply.
from the Heart. What else?
I just want to say thank you to all the veterans and listeners that can say today. My dad
Yes.
was a Marine in World War II, and I thank you guys.
Thank you for the service to the veterans. And we'll continue to honor those who have served us. Arlene?
As a resource, Hospice of Santa Barbara, if you have to apply to be on their services, but if you're on their services, you don't have to be terminally ill, and they have volunteers as
Okay.
well, so.
Everybody get that? Hospice of Santa Barbara, sign up on their website. They have volunteers for certain activities as well. Okay, what else? Oh, come on, guys.
Two things. First of all, you mentioned some people start losing skills and keeping some skills. What skills are normally kept the longest?
So the question is, what skills are kept longest once you've been diagnosed?
Right.
The skills that are kept longer are the ones that are mostly well sedimented in your brain. So, for example, I had a judge in our facility. He wouldn't be able to do the paperwork anymore, but he would sit on the piano and play beautifully because he had been doing that all his life. So the more sedimented in your brain, they stay longer.
Secondly, my girlfriend and I just moved into San Quentin from time machine.
Congratulations.
And I'm getting to notice some of these things amongst the residents. And I do have to say, women age better, and men watch out.
Women age better and men watch out. Yeah. There you go. That's the lessons that he has learned from living at summer camp, which is a wonderful continuing community.
And
Yes.
just have been surrounded with so many 80-year-olds.
Yes. But in most memory care or assisted living where you go, you will find 80+% women and then a good bunch of men there who, yeah, that's our reality. Watch out,
You go
yeah.
first.
And if you are good looking, oh my God, the ladies will be all over you.
Nobody's there.
Watch out.
Yeah, some of their communities are super driven. Okay, what else? Other questions?
It's not a question, but I'd like to see the slide right after this one, with the two resources. Yes, that is.
Okay. Yeah, I'll send it out to you, Gigi.
Oh, okay, then thank you.
Okay, so,
Yeah, I have a question.
yes.
You never mentioned anything about brain exercises like crosswords or puzzles
That's a
or
great
learning
comment.
a foreign language.
Are there brain exercises that will help with your cognitive ability?
Absolutely, they are fabulous, they are great, and you want to do them before you have dementia. Anything that gives you pleasure. If you like doing crossword puzzles, do it. People like to play games on the computer, that's good for your brain. There are computer software that are meant to stimulate eye coordination, and they are fabulous. But before you have dementia, after you have dementia, that is going to torture you. And that's a mistake that a lot of caregivers make. You know, my mother has dementia, so I'm going to give her a crossword puzzle and I'm going to make her do it. You're torturing her all the time. Work with their skills, not with the skills you want them to have.
Thank you.
Great.
Is this video going to be posted?
Yes. So now I have a new website. It's terrydiamond.com. The videos are posted or linked to it, but there's also the schedule for seminars, so you can go there, click on the seminar, it will take you right to the video, or you can just go to YouTube. Okay,
The New York Times online has these puzzles that have you ever done?
great.
Yeah, there are puzzles and games and everything. So for those of you who know, who come often, I give away 2 $25 gift cards for just showing up. And then also Luciana gracefully brought us 4 books that we're also gonna give away. And then on your surveys, I do a drawing for everybody that fills them out and turns them in. I do 1 $50 gift card for that. So Luciana, do you wanna?
Sure.
Come on me? You have to be present to win.
Present to me. Here. Sally Russell.
Sally.
Woo.
Go. Okay, draw another name. Right here. No peeking.
Geraldine Gibbons.
Gigi. Geraldine.
Yay.
This is a book called Ahead of Dementia. It's a great book. Okay. Let's do another one.
They don't want the book, they want the $25.
Okay,
So,
well, that's how we're gonna get
we're
right
gonna
now.
get there, we're gonna get there. Lynn Ellens. Woohoo!
The lucky table here.
Go, Lynn.
$25 gift cards.
I'm picking up another one already.
Okay.
This one here, okay. Susan Newton.
I don't think she's
Susan Newton?
She lost money today.
Jan Inoue.
Yeah.
There you go.
There you go. Okay,
Now
two
we're
more.
ready. 2 more?
Yeah.
Oh my God. Barbara Ellis. There you go. My lovely. Yes.
Okay, and last one.
Last one. Chris Gallery. Oh my God, that's a many people right there.
There you go. Okay,
That's
next month, holiday surprise. It's a surprise. Don't forget to RSVP.